and that's the topic that you'll be talking to us about. You're also a director of scholarship at the US Transhumanist Party. So Dan, it's absolutely wonderful to have you with us and for you to step in so graciously at such short notice. I'll just share.
Yeah, thank you.
Your slide.
Yeah, it's exciting to be here, and I'm learning a lot, and it's really great to see all that's happening in Africa now, and the energy and enthusiasm. And I've been following TAFFDs online, and I'm just really happy to be here. And yeah, so we're going to change gears a bit, and I'm going to present a few slides. I didn't have time to prepare anything specifically for this, but I have some slides that I can show. So this first slide here is just giving some background to who I am. My background is in physics, and I did a whole PhD in physics. But after that experience going through the PhD and doing research in physics, I decided that I wanted to move into machine learning and AI. So what I ended up doing was doing some postdoctoral work at the University of Maryland, and there I was working on machine learning, and we were looking at molecules and trying to predict properties of molecules. So I'm not going to go into that, but more recently, about the past year or so, I've been working at the NIH, and here's that picture in the last slide was just showing the building I work in. It's a hospital, which is one of the largest research hospitals in the world. And what I've been working on is, and that the other guy there is the guy I work for. But what I've been working on here is shown here. I mainly have been applying AI and deep learning to to automate specific tasks in medical image analysis. So the specific thing I work on, which is like colorizing certain things in the images, which we call segmentation. So if you look at the images on the left, those are images from a CT scan, and that circular thing there in the top left image is the aorta, which is one of the main arteries. And as you can see, there's a bright ring there, which is plaque. So one of the things I work on is measuring developing automated ways of measuring the amount of plaque, and that can be useful for predicting health outcomes, and also reducing the workload for doctors who may have had to do that manually in the past. The other thing I've been working on is looking at the spine. So on the right, you see another image from a CT scan showing a cross-section of the spine. And using AI and deep learning, we can actually colorize the different vertebrae and label them automatically. And then we can do automated measurements of the bone mineral inside of that. So that's kind of what I work on. It's actually fairly basic stuff in terms of the deep learning. So I'm going to just speak a little more generally, though, not go into the technical details, because I don't think that would be particularly interesting for this audience. So in general terms, there's really been 3 eras of AI. The field of artificial intelligence is actually very old. It started, I think, back in 1964 or 65, and it's gone through a number of phases. One of those phases is what you might call AI 1.0. And so in AI 1.0, you would have an image, which is your input. And then you would have a programmer, and they would do a lot of custom programming to teach the computer how to analyze that image. And it involved a lot of work and a lot of domain knowledge and a lot of engineering type work to extract certain features from the images, and then teach the computer how to analyze the image and then come up with a diagnosis. So typically you're looking, trying to diagnose something. Might call it AI 2.0, which was machine learning. So in machine learning, instead of programming in everything explicitly, the computer can actually learn things on its own by looking at many, many images. And that was a major advance. So this, and then if we advance the slide a bit further, more recently we have AI 3.0, which is deep learning. So I'm guessing a lot of you probably heard of deep learning. It's been a very kind of a buzzword. Deep learning is a subset of machine learning where we have these neural networks that are now much bigger than they used to be, and that's why it's called deep learning, is because there's many layers that go in these networks that go very deep. And this has really taken a lot of the need for custom feature engineering out. So really all you need to do deep learning is a data set, a large data set, and then you set up this deep neural network and it can learn from that data. So that's kind of the era we're in right now, and this is the advent of deep learning has really transformed machine learning, and now we're seeing human level accuracy achieved in many different areas like image classification and medical disease diagnosis and things like that. So you can go to the next slide. So this slide is showing what can be achieved when you apply deep learning to medical images. And I think the year 2017 was a major year because that's when the deep learning and AI achieved the level of performance that the average doctor would have, and in some areas actually became better than your average doctor. So one of the first systems that became better than your average doctor would be system developed at Stanford University for skin cancer classification. And so they were just looking at images of skin lesions and classifying them as either benign or malignant. And as you can see, this is not an easy task. As you can see, those skin lesions look very similar. So it's looking at very subtle features there to decide between benign and malignant. The other one that came out in 2017 was looking at microscope slides, and that was from Google. And they were able to classify these images of cells as either benign or cancerous, and that's also very, very challenging. The key to getting to this accuracy was just having a very large training data, thousands of training images. So you can go to the next slide, I guess. I'm not going to spend that much time on this slide, but the point of this is there's now many systems that have achieved the performance of your average medical professional. And so there's a paper here which is mentioned at the bottom of the slide. If you go back, yeah, just at the bottom there's a paper you can look at, and in this paper they do a very thorough review of the literature, and they basically look at all the studies that have come out that compare the AI and deep learning with medical professionals. And they found that that the AI and deep learning models are achieving the level of performance of healthcare professionals in 14 different areas. So there's now actually many different examples of systems which achieve the accuracy of your average doctor. That's really important because you know, a lot of parts of the world don't have access to many doctors. So if you have a system that's at the level of like your average doctor, you can use that for diagnosis, or at least for triage and prioritization, healthcare prioritization. It's also important to note that doctors fall on a large range. So, you know, you have good doctors, bad doctors. So, you know, there's still doctors out there that are probably better than these AI systems, but these AI systems at least have gotten to the level of your average doctor, which is very, very impressive. So you can go to the next slide. This is just showing there's a lot of startups. There's you know, tons of entrepreneurial activity in this area now. And I think a lot of the potential is in the emerging developing world, because that's where these AI systems are going to have the greatest impact. Go to the next slide. This is a book I read, which goes into great detail about how AI is going to impact medicine, and one of the points of this book is that doctors are really overworked. This is especially in the United States. The radiologists who look at the medical images, they have huge workloads, and they usually can only spend like 10 or 20 minutes with each case. So there can often be things in these images that they're just missing because their time is so limited. So that's where AI can come in and really help a lot. and again, I think this is going to be especially important in developing world and developing countries, and in Africa, where there's fewer doctors per capita. The other thing I've heard about Africa is that there are not many CT scanners in Africa, but there are a lot of chest X-ray machines. So, and there's you can even have portable chest X-ray, which can be mobile. You can have them in a van or in a car, and so there's a lot of these chest X-ray machines, but there's a very limited number of doctors. So that's where the AI can come in, and you can have the chest X-ray analyzed by the AI, and you can at least get some diagnosis from that. And then if given the AI diagnosis, then you may, depending on what it is, you may want to go to an actual doctor. Yeah, so I know my time is limited here, but I also have a slide here on personalized medicine, because that's a whole nother area. The cost of like doing a DNA sequence is coming down a lot, and so there's a lot of work seeing if we can predict health outcome from DNA sequences. But there, what we need is people to donate their data. We need people to contribute their genetic data, so that scientists can perform studies and analyses on all of the different sequences. You can go to the next slide. We can skip this slide. This is just showing like we can do precision medicine. This is something, the countries differ a lot on this. Like Estonia has a big open data initiative. So they actually have gotten the genomic data from 52,000 people. And that's going to be a major asset for not just Estonia, but the whole world, because then we can analyze all that genomic data and learn how to use it to improve health. So I think I'll leave it there. You can. I'm happy to answer any questions. And I wasn't sure how much time I had, because I think it was just 15 minutes on the schedule.
That's fine. I mean, so fantastic. Thank you for stepping in at such short notice and sharing some of the advancements that we often hear about AI in healthcare, but it's try to quantify how much of an advancement that there has been over a period of time, and I think you've demonstrated that, and some of the benefits for those countries and regions where access to healthcare is restricted, not just because of qualified doctors. Quite often you'll get a doctor that will do around, spend weeks visiting various rural villages and what have you. So, it's having early access to data. And I think from what you were showing about being able to do perhaps some of that triage process, certainly in the areas of cancer and others where, things that can be caught earlier in the stage, which would actually sort of have a more positive more positive impact on healthcare in general. So please raise your hands if you've got any questions for Dan. I'll now open the floor for a few questions before the next speaker. Give them time to raise their hand. I think you've you've probably overloaded them in some extent.
I know it's a lot. I probably should have cut out some of those slides, but
no, that's fine.
Yeah. there's a lot of exciting things happening with AI, and I guess what I'm most excited about for Africa is like I said, being able to use AI for the chest X-ray, to do a maybe not a perfect, it won't be a perfect diagnosis, but you at least get something, right? And then you can decide, like, so what could happen is the AI would say, the deep learning would say there's a 90% chance of pneumonia or something, and then you can send that and you can do triage. You can send that person to the hospital, for for expert medical care. But I think it's right now it's at the stage where it's probably most useful for triage. In the US, I think there's actually a lot more barriers for adoption in the US. That's just my feeling. So
is that something, I guess, you touched on the point about sort of gathering data on the DNA side for personalized. Obviously that's there's a whole other area of ethics that opens up, in terms of ownership of that DNA sequence is owned by the individuals, by do you think that because the dynamics are slightly different in somewhere like Africa, people would be more open to using these processes for triage, early diagnosis of cancer or pneumonia, or any number of other
I
conditions?
think certainly for the medical imaging, I think the benefits are just going to be so enormous relative to what they have, that it will be obvious that it's a good idea. Now, here in the US, we already have a lot of radiologists, and the radiologists, they're kind of skeptical of AI, and they see it a little bit threatening to their their jobs, and kind of, so there's some resistance actually to this. But I feel like, and then also, of course, we have the FDA, we have a lot of bureaucracy and regulations and stuff. So I feel like in Africa, it could be adopted much faster, which I think would be good. Now, we do have to be careful. I think there has to be some regulations, and we don't want it to be like a Wild West.
No, this is the concern, that when you were just saying that was my immediate concern. Brenda's just raised her hand. Perhaps you want to add something to that.
Okay. Hi, that was very informative. My question is around the regulation, as you've just mentioned. What I want to understand is, to what extent are you guys working with regulators to ensure that it is easier to put this into practice, and also for to take away that fear that a lot of people have got in terms of breach of privacy and all of that? I mean, if I think about regulations like GDPR, which will apply to you guys in the US, and in South Africa, for example, we've got something that they call POPIA, which is the Protection of Personal Information Act. So to what extent are you ensuring that you involve the regulators so they understand exactly what the benefits are and they do not stop the advancement?
Well, I'm definitely not an expert in that, but I have met some people who work at the FDA here in the US who are working on regulation of AI, and they are working on it. They are working on figuring out how to regulate it and make sure that the AI is really safe. So, and I think so, I think that the FDA is doing a fairly good job, just based on what I've seen. That they have approved some systems already, and so that might be something you would want to, is FDA approval. As far as the privacy issue, that is something that people do have strong, very, very strong concerns about. I think that may require, additional local regulations, and yeah, I can't really speak specifically about that, but because I'm not really familiar with, the legal system and everything in Africa, but it's something that's a major, I know it's a major concern here in the US, and typically, hospitals end up owning the data. A better system maybe for people to own the data, but that's kind of here in the US, the hospitals kind of own all your data. So yeah.
Do you think, Dan, that's perhaps a way for, or an opportunity for blockchain technologies to ensure that data isn't manipulated, and that adds some I guess reassurance for the person whose data is being sampled? Or I mean, already in most countries we have privacy of medical data is already included in the privacy legislation already. So it's really, I guess, just a case of where other regions and other nations are with that whole set of privacy legislation, of which medical records form part of. I'm very conscious that we've overrun. I know that we've got hands up from Idara and Adil Khan. I'll just unmute Idara Isang for a moment, if it's a quick question.
Yes, hi. I just kind of got access to the conversation on the AI use. I think one of the, actually, from my knowledge of the society there, they don't really have a lot of reservations about, privacy and such like that. There's not really a lot of systems in place or inclination by people to safeguard data, although, from the way the government is of the day, they should be more kind of like conservative about that, but really there's no issue culturally or, in place. So it probably would be, not a problem to adopt it. One of the things I think would be really great is if they could invent something that could do actual lab tests by AI. So maybe you can purchase something at a pharmacy and provide bio sample like blood or saliva or whatever, and it could kind of read the reactions between your saliva or whatever, and whatever substances are in the whatever the the device is, and then maybe it's sort of like if you somehow connect that to a cell phone to feed the result, and then you could probably diagnose actual diseases, perhaps based on reactions. I think there are tests that can do that, and the reactions are interpreted by people, I guess. But that's probably something that they could do. That would be very, very good to adopt, and the results would be between the person and the doctor. I don't know, but
Mm-hmm.
Yeah.
I think the first point you made is great, is a really good point. People's, you know, the amount that people are concerned about privacy varies a lot between countries.
Yeah, exactly.
So I think people in Africa may be more willing to donate their medical records to scientific research, which would be really useful potentially. Yeah.
Yeah. So, okay, thank you
Mm-hmm.
for that.
Sure. Yeah. And the other point you made was also good. I mean, blood tests. Mm-hmm. I don't know much about that, but it is something that can be done.
Excellent. Thank you so much, Dan, for stepping in last minute to give us that insight into AI with regard to medical imaging, which obviously you're very much involved with. Obviously, the recording will be shared. That last slide obviously gave some contact details for yourself, should anybody want to raise questions after this. What I'm going to do, because we have overrun by about 5 or 6 minutes. I am going to just call for a quick 5-minute break to allow people to grab another glass of water, to use the bathroom or whatever they need to, and then I'll be resuming in just a few moments.